Good morning, everyone, and thank you for taking the time out of your busy schedules to sit down and listen to this presentation. My name is Brian Gingrich Jr., and I am the Associate Director here at Ocean University Medical Center within Hackensack Meridian Health. I'm excited to share the opportunity and opening of a future urgent care clinic within 20 miles of UMC. This presentation has feasible details for the upcoming project and the steps that we should take. So once again, our objective is to find an urgent care within 20 miles radius here in Brick. We're going to look at all the demographics, the demand in the area, financial implications. Also, we're going to keep in mind that we are still going to give same service and care to our patients and to the local community and meeting the demand for health. So looking by this radius map, and where to expand our urgent care. I believe we've determined that Manchester Township in Ocean County is where we should bring the health care, which, as you can tell, is the bottom left corner of the map. About Manchester Township, it has a population of 46,000 people. Medical calls, they do roughly just shy of 11,000 a year, where 65% of those calls go to Ocean Medical Center. The number of urgent cares in the town, shockingly, is 0. Their closest urgent care in that town is 9 miles away in Toms River. They have 4 hospitals within a 20-mile radius. Their closest hospital is Community Medical Center in DeBoer, which is roughly about 12 miles both ways, west and east. Ocean Medical is about 13.5 miles away. And then you got Monmouth South and Lakewood, which is the same amount of miles. Land is about 81.42 square miles. Okay, the microeconomics model. Some of the key elements that we should bring and look into is supply demand, the market structure, patient decision making, provider behavior, and price sensitivity. Now, if you look at all these questions, we have to what is the location for traveling, for our patients? Manchester is quite big, so, is it worth it for them to go 30 minutes away, drive to an hospital to an ER visit, or are they willing to come to us? If their symptoms are very high risk, like shortness of breath or something like that, where they need call 911, we will have to tell them, please call 911 after you hang up the phone. Or we will call 911 if they come to us. The operating hours, and we'll probably start at maybe 10, 12-hour days. See how high the demand we are. And if we have to, we'll be 24 hours within maybe a 3-day period. The number of staff members we currently have. The prices of services with our insurance and out-of-pocket payments or cash. How's the competition area with other medical services, usually between their primary cares that they have or the specialties that they might go visit, or old school, house doctor visits. And we also have to make sure our reputation of our providers and our business is top notch. Otherwise, we're not going to do well. Public policy role, environmental regulation, local and state health code. Make sure we're up to date on that. Licensing requirements at forever position. All team members on the first day they start at this position will have an active CPR license from the American Heart Association. Affordable Care Act, expanding insurance coverage, which increases demands for patient accidents. Incentives, depending on the demographics in the area, potential funding and/or tax breaks from community access. We'll be cost saving for patients compared to emergency room visits or waiting to see the primary. We create space for additional services if we have to. There's some behavioral issues, or we have like our local unions for occupational health for any related illness or injuries. And as of right now, we would be the only urgent care in town. Some of the challenges, cost efficiency while maintaining, an equal care, quality of care and treatment to our patients. And if we put our urgent care, what other competition will come along as well? Reimbursement rates on insurance, and most importantly, what's the talent pool to make sure we don't have a high overturn of staff members. So a typical cost here in urgent care from New Jersey is about $800,000 to $1.2 million. The break even will be roughly about 14 to 18 months. And with projections for a year, we're looking hopefully about $1 to $5 million. Operations should just be shy of $475 million. The average visit is $125, and we're expected for the patient volume to be roughly about 28,000 just for the first year alone. Justification to the model, trying for the community, we will try to improve health access to the older community, especially when you're 25 plus minutes drive to your local hospital for them. And a lot of the senior citizens above the age of 60 were refusing to go to the hospital for any treatment for the ED, even for the minor stuff. So I think this will work out much better for them. Decision making, using similar information from our networks, urgent cares that we have throughout the state and demographics, and trying to get an accurate report on the patient's behavior. Our goals are to become an important part of this local community, and we want to be at the ground, sturdy place for them, saying we are here for you. And we continue to build a revenue, and hopefully we can expand and get bigger over time. This is an excellent opportunity for the network and the local community that needs the service, and I believe we can make something happen from the decisions. We are here to give the patients the best care and treatment. Let us show Manchester what HMH brings to the community. I recommend planning this project and begin the following phrase of putting it into action. Thank you so much for your time, and everybody have a good day. Thank you.